It's a very interesting concept that was thrown on us for the first time from the Destiny Breast 04. We never thought about HER2-low as an entity, and it was hard to first ascertain, is it a biomarker that predicts response to a certain therapy or benefit from a certain therapy, or is it its own unique entity? And to that extent, we've been doing lots of studies, us, our group, and other groups, not only in the nation, but globally, trying to see if the HER2-low is it a true entity or subtype of breast cancer that has its own prognosis, its own outcome, and stuff like that, or is it just a biomarker of response of a therapy? And until now, we don't have an answer for that, so it's still up in the wild, to be honest. A lot of studies looking at the same population contradict themselves. Some of them think it is its own entity that can have its own prognosis, but other people believe it's more of a biomarker. And because of that, at one of the San Antonios, they did this debate: is HER2-low truly an entity or a subtype, or is more a biomarker of response? And both of them had valid argument for each one of them. But yes, so this HER2-low was like introduced for the first time with the emergence of the Destiny Breast 04 results. And it was really interesting because a lot of people believe that there is no such thing as HER2-0 because HER2 is expressed in all cells of the body. So is there truly a zero type, or all of them are low, but some of them are more low than others? So again, it's very interesting, and it's still an evolving field, especially because the current techniques that we use in measuring HER2 status were not made to measure the difference between 0 and 1+. They were more measured to detect who is truly HER2 positive, like those 3+ from those that are not as 3+. And there is a very nice paper in JAMA Oncology that took 18 experienced pathologists. So these are the pathologists that sits on big national, international clinical trials as a central reviewers. And they gave them multiple cases, and they want to see the concordance between 0 and 1+. And the concordance was only at 26%. I mean, these are experienced pathologists that do the central reviews, yet they could not agree between themselves what is truly 0 and what's 1+. So that tells you that we need to do a lot better, especially that we're having this amazing therapy that, in my opinion, and opinion of a lot of people, it is like an inflection point in the field of hormone-positive breast cancer. So it's the era of before trastuzumab deruxtecan, and there is the era after trastuzumab deruxtecan. That's how important this therapy is in any patient that's suffering from that disease. So it's really important to get it right and give it to everybody that can benefit from it.